parenting book authors don't land on bestseller lists by suggesting children are naturally resilient. Think about it. This entire apparatus depends on convincing you that your child is perpetually on the brink of some psychological catastrophe. And only by following the latest expert recommendations can you prevent this irreparable damage. It's the same playbook the pharmaceutical companies use to get more and more people identifying with uh, medical conditions labeled as mental illness that drive you to using their solutions, which is drugs. We're talking about 25% of the American public, adult public, on at least one psychiatric drug. That can only happen through this scam. It can only happen by trying to convince people that what is often natural and normal is a medical condition. And to do this, you have to push emotional fragility. They have to plant the seeds that your emotions are dangerous. They have to plant the seeds that you're ultimately fragile, and you have to do exactly the right things to prevent this fragility. And this is why I think we see the rise in these mental health diagnoses, not because people are inherently fragile, but because we treat them as such. And this dates back to kids being very, very young. It's this situation that I observed in a waiting room. If you can't even tolerate 5 minutes, 10 minutes to wait, to develop patience, and not to to respect your parent, who in that moment should have the ultimate authority, well, then how are you going to deal with all the disappointments, challenges, and adversity that life is going to bring? They actually need to hear the word no, because these are not traumatic events. They're essential building blocks for emotional resilience. And we've created a culture where parents believe their primary job is to prevent their child from ever feeling bad. And when they do, parents feel bad themselves. And this science could not be more clear, which is why I'm so hard on therapists and mental health professionals, because they actually act outside the bounds of psychological science. And let's face it, most therapists aren't trained in science. They're trained in some weird form combination of pop culture, psychology, and pharmaceutical propaganda. To me, the science of resilience, which is the essential quality that allows human beings to bounce back from adversity, overcome challenges, where there's an evolution and adaptation process that we can forge, that parents actually have a responsibility in being able to build. This isn't done unless there is exposure to manageable stress. We call this stress inoculation. And it's the fundamental nature and aspect to the development of resilience. It's kind of like going to the gym. You first start with kind of light weight and you're very sore and you're not in great shape. But then you continue at it consistently and you get stronger. The same thing happens with stress inoculation. You start with things that aren't very stressful, like sitting in a car for a period of time without having constant stimulation, or being able to tolerate boredom in a waiting room. And let's face it, you go to these waiting rooms, and my waiting room's the same thing. You have like children books available. You can color, you can create, you can do things a lot more productive than stare into a screen. And then we create these bullshit diagnoses like ADHD. That's just a natural consequence to everything I'm seeing in culture. How do you think kids are going to evolve when their faces are in screens like that? If you can't tolerate 5 minutes of frustration or boredom and direct your attention into something else, how are you going to get through 5 pages of a book? How are you going to sit in class? Let's be real, people. Let's wake up to what is happening.